Feeding Video 2: Common Feeding Problems in Young Infants. If you haven't already, please watch Feeding Video 1, An Introduction to Infant Feeding. In this video, we will describe common feeding problems babies can have and list ways you might help with each problem. In the next video, we'll go into detail about the techniques and strategies we've mentioned. Feeding Problem 1: State Control. Babies who aren't able to get into the right state aren't going to be able to eat well. If you're screaming and can't calm down, or sleeping and can't wake up, you won't be able to eat. There are several different techniques or strategies that can help babies with state control related feeding problems. Sometimes these problems are to do with the timing of the feeds. A baby who isn't hungry yet may be sleepy and not responsive to your attempts to feed, but being over-hungry can make babies very cranky and hard to calm. Babies with state control related feeding problems often need help preparing to eat and may benefit from a certain environment to eat their best. They also might benefit from external support. External support, such as bundling or shoulder bundling, can help an irritable baby calm and can help all babies focus their energy on eating. Feeding Problem 2: Slow Eating. Because eating is aerobic work for babies, taking too long can burn too many calories and be very tiring. How long is too long varies from baby to baby and depends on whether the baby is breastfeeding or bottle feeding. Bottle-fed newborns should be able to take a full feed in 20 minutes or less. It can be a little longer with breastfeeding. Sometimes slow eating is related to timing or state control problems. Other times babies are slow eaters because the milk is not flowing at the right rate for them. If milk is flowing too slowly, babies will have to suck extra hard and burn extra energy. If milk is coming too fast, some babies will cope by eating less efficiently to slow down the flow. It's one way babies can protect themselves from making swallowing mistakes. A baby frequently breaking their latch or lip seal, which can make a little clicking sound, or pulling him or herself off the nipple, especially with milk still in his or her mouth, or losing a lot of milk out of the corners of his or her mouth are all signs that the flow might be too fast. So what can you do to help? For bottle-fed babies, positioning to control the flow, bottle or nipple choice, and external pacing can all be important. The baby could also be distracted by the environment, and timing may also be a factor. Feeding Problem 3: Overeager eaters. Some babies, including many babies going through withdrawal, want to suck all the time. Many of these babies are great eaters, but others are so eager to suck that they run into problems like not pacing themselves or making swallowing mistakes. For these babies, preparing the baby to eat, providing external support, positioning to control the flow, and providing external pacing can all be helpful. The environment can also affect how these babies eat. Problem 4: Swallowing problems. Some babies will have trouble swallowing properly. These problems can appear right at birth, but sometimes they show up a little later, often around 2 months old. Just like adults, many babies will cough or miss-swallow sometimes. But if this happens regularly, or if you notice any of these signs or any other big changes in your baby's feeding, it's important to get it checked out. Speak to your health care provider and ask for a referral to an occupational therapist or other feeding specialist. Problem 5: Refusing to eat. Sometimes a baby will refuse to eat altogether. This can be due to a swallowing or other feeding problem, or it might be a sign of an illness. Babies can get dehydrated very quickly, so if you're at home and your baby's not eating at all, get in touch with your doctor or public health nurse or go to an emergency department immediately. Your baby may need to be seen by a feeding specialist, but first he or she needs to be checked for dehydration and other life-threatening conditions.